If your teeth are starting to look worn, yellow or aged, would you like to know what you can do to have an attractive, bright white, great looking smile, no matter how old you are? Well, I'm going to tell you how you can have a great smile without being fearful of losing your teeth or panicking about unknown and unexpected dental expenses. I'm Dr. Rachel. I'm a holistic dentist. I've got over 3 decades of experience, and I'm going to give you a step-by-step approach for caring for your smile so that you will have a clearer understanding of what is best for you and how to care for your teeth and smile now and for years to come without massive dentist bills. We'll go through 5 steps to avoiding expensive dental bills without you needing to lose your teeth. Along the way, I'm going to share with you some simple tips that you can use to avoid expensive dental bills and keep the smile or have the smile of your dreams. I want you to stay tuned to the end for some bonus tips to avoid and fix common dental problems. So number 1, practice excellent dental home care. Brush and floss at least 2 times a day and use a sonic or electric toothbrush with a soft head. Use an antibacterial alcohol-free mouthwash and a toothpaste that you like the taste and feel of. Choose a floss that you're comfortable using. You may need to try a few before you find the right one for you, or you may prefer to use an interdental or proxy brush to clean between your teeth. Brushing and cleaning between your teeth are crucial if you want to maintain healthy teeth and gums. After all, what's the point of having straight white teeth if your gum health is so bad that you end up losing your teeth, so the only pearly whites you have are the sort that you take out at night or they're held in on dental implants? Prevention is much better than cure or management of a condition, and when it comes to prevention, focusing on oral hygiene is a must, so I'm going to go into that in a little bit more detail now for you. When it comes to brushing, there are some basic rules or guidelines you should follow. Brush for 2 minutes, brush twice a day, after breakfast and before bed. Use a good toothpaste. Check out the natural ranges that have ingredients that are kind to your mouth and your body. Clean all your teeth, don't forget the back ones, and brush your gums as well as your teeth. Brush firmly but not too hard, and change your toothbrush regularly about every 3 months. Did you know most people only brush once a day? And when they do, they brush too hard and not for long enough. The average time spent moving the toothbrush over the teeth is approximately 20 seconds. 20 seconds? That is not enough time to remove plaque from your teeth. And any plaque that you don't remove solidifies into a hard layer called tartar. And that's the stuff that we have to scrape off your teeth at the dentist when you have a professional clean or scaling. So here's a tip. Set a timer for 2 minutes when you clean your teeth. Love it or hate it, flossing. Flossing is an important part of keeping your mouth healthy and preventing tooth loss. Your toothbrush just does not reach between your teeth, and this is where food and debris and plaque builds up. Well, brushing your teeth and not flossing or not cleaning between your teeth is like taking a shower and not washing your armpits. Yeah, disgusting. Flossing is going to help keep every surface of your teeth clean. It's going to reduce the risk for tooth decay and gum disease. Did you know 40% of your tooth surfaces are inaccessible to your toothbrush? So my advice is floss twice a day, every day, after breakfast and after your last meal of the day or just before bed, so that while you're asleep you don't have food and plaque sitting between your teeth. As long as you use the correct technique, it doesn't really matter what type of floss you choose. The best one is the one that you're going to use. So you might have to try a few different flosses to find out which works best for you. I'm going to give you a tip here. Invest in a good electric toothbrush like a Philips Sonicare. I don't have any sponsorship. As we get older, our manual dexterity reduces and it makes it harder for us to clean our teeth effectively. Number 2, I want you to choose foods that are good for you and good for your teeth. Eat non-processed foods, avoid sugar or junk foods. Your teeth, like your body, need a good, healthy, balanced diet. So make sure you're getting a diet that's high in minerals, vitamins, and antioxidants. What is good for your body is also good for your mouth. As the saying goes, we are what we eat. How we feel, how we look, our overall health really depends on what we put in our mouths. We want antioxidants and other nutrients that are found in many of our foods, because what we eat will help strengthen our immune system. It's going to improve the body's ability to fight bacteria and inflammation, and all of that helps protect your teeth and gums. So when it comes to oral health, today's nutritional approaches need to go way beyond the traditional advice of don't eat sugar. So I'm going to go now through 5 food tips that you can use for a healthy mouth. Choose vitamin C. The antioxidant vitamin C, it's found in oranges, strawberries, tomatoes, and other fruits and veggies. It helps protect your gums and other tissues from cellular damage and bacterial infection. It also plays a role in the production of collagen, which is our scaffolding, and that's going to help maintain your gum strength and integrity, and it's going to prevent receding gums. Dine on greens. Green veggies, these are high in calcium. Your green leafy vegetables, seaweeds, and sea vegetables, so rich in calcium and minerals, and these are the goodies that your body needs. Calcium is vital for healthy teeth and bones. It's going to reduce the risk of tooth loss. It protects your teeth, and it also protects against gum disease. Vitamin D is essential to help your body absorb and use calcium, so make sure you're getting some sensible sun exposure, eat free-range eggs, or supplement with cod liver oil to get enough of this magic vitamin. I'll share a video for you on that. Enjoy raw food. Crisp fruits and raw vegetables such as apples, pears, carrots, peppers, and celery. Hate celery, but some people like it, but it's like crunchy and crisp. These help clean plaque from your teeth, and it freshens your breath. Sorry, just banged there. Well, what was I saying? The high water content in the raw fruit and vegetables, that stimulates your saliva flow and adds to your saliva flow, and that helps wash away food particles. When it comes to your fruits and vegetables, go dark. Eat dark green leafy veggies such as broccoli, kale, and spinach. Peas and asparagus are pretty good choices too. Leafy greens promote oral health as they're full of vitamins and minerals, and as I said earlier, very high in calcium, which helps build your tooth enamel. They also contain a type of B vitamin called folic acid, and that has numerous health benefits, including possibly treating gum disease. Drink up. No, it's not last orders at the bar. Drink water or herbal and unsweetened decaf black or green teas. Water helps you to produce saliva, and that's your mouth's best defense against tooth decay because it contains proteins and minerals that helps counteract the enamel-eating acids that the bacteria in your mouth produce. Tea contains a compound called polyphenol that slows the growth of bacteria, the bacteria that are so associated with cavities and gum disease. For a healthy mouth, keep it simple. Focus on a well-balanced, nutrient-dense diet versus individual nutrients. Eat plenty of fruits, veggies, lean proteins such as fish, eggs and poultry, healthy fats, avocado, nuts and seeds, coconut and olive oil. I'm going to give you a tip. See what changes you can make in your diet. Perhaps it's eating more greens and veggies or taking a mineral and vitamin supplement. 3. Avoid foods and habits that stain your teeth. Tea, coffee, red wine, soft drinks, sports drinks, pasta sauce, curries, balsamic vinegar, and foods such as berries, beetroot, and anything containing turmeric will stain your teeth. Essentially, if it's going to stain a white shirt, it's going to do the same to your smile. Smoking. Smoking is the #1 habit that is going to cause yellowing and staining faster than anything else when it comes to your teeth. Not only is smoking bad for your health, it also damages your smile. It is the leading risk factor for gum disease and oral cancer. To keep your teeth looking clean and fresh and prevent staining, reduce your coffee and tea intake and switch to water when you're thirsty, and rinse your mouth out with water after you've eaten. Another fact, I'm giving you a lot of stuff here today in this video. It's going to be jam-packed full, so you might have to go back and watch it a few times just to take everything in. You might want to make some notes as well. Did you know we all have the same colour enamel? Yeah, it's true. Whether you have white, yellow, grey or brown looking teeth, it's due to the colour inside of your tooth, and that is partly due to genetics, like why'd you get blue or brown eyes. Number 4, I want you to opt for the best dentistry you can afford and never settle for patch and repair work or quick fixes, because having cheap dentistry is not always the best option, as the materials and sometimes the work is going to be of inferior quality. Look, a cheap fix always costs more in the end. Do you think a dentist is going to get their tooth patched, or would they want to have it fixed properly? Of course they would. We're always going to opt for optimal treatment. And yeah, you might say, oh yeah, but that's okay for you. You can afford it. And yeah, I agree with that. And that's why I say, opt for the dentistry you can best afford, because patching and repairing means you're at more risk of having repeat dentistry on the same tooth. You're at risk of fracturing teeth, getting more tooth decay and ending up with more expensive dental problems or tooth loss, where you just opt to have the tooth out because it can't be fixed. When it comes to dental care, I want you to ask your dentist to present you with all the options, along with all the advantages and the disadvantages of each, rather than just making your decision based solely on price alone. I'm going to share a little secret here with you. A lot of my dental colleagues, they judge you. Maybe not in a bad way, but they judge what they think you can afford to pay for treatment. And then because of that, and they don't want to risk upsetting you or offending you, they have decided that somehow they magically know what your bank balance is. And they then base their treatment recommendations on whether they think you can afford it or not. And often they are not presenting you with the best option or all the options. So I want you to make sure that you ask your dentist to present all the options for your tooth, irrespective of the cost. And this way you can make a proper informed decision, and you can be confident that you're making the best choices for you, your teeth and your smile. It's going to pay to opt for the best long-term option when it comes to getting your teeth fixed, even if that might seem more expensive at the time, because in the long run it's going to save you time and money, it's going to give you peace of mind, and it's going to prevent you from having dental emergencies in the future. So here's a tip: join a health fund or start a dental savings plan whereby you can put a sum of money aside each week and make an investment in yourself to support with the cost of your dental care and the health of your teeth now and as you age. Number 5. Don't ignore bleeding gums, drifting and crowding teeth or pain. Gums that bleed, teeth that drift, teeth that have moved or are starting to crowd, pain in your mouth. These are all signs of gum disease or dental decay or infections. Ignoring these early warning signs is a sure way to end up with expensive dentist bills and, worse than that, false teeth and dentures. Gum disease is going to eat away at the bone that holds your teeth in, and that needs to be treated effectively and immediately. Gum disease, also called periodontitis, which means inflammation. Itis is inflammation. Periodontal, that's the structures that hold your teeth in, essentially. Trying to look for a really simple way to explain this. This is a bacterial infection. Symptoms will include red, swollen, bleeding gums, bad breath, receding gums, loose teeth and tooth sensitivity. Harmful plaque bacteria cause inflammation of the gums and the bone around the teeth, Left untreated, it's going to make the gums pull away from your teeth and cause bone loss around the teeth. Once it advances, it's a serious infection that will destroy the supporting structures that hold your teeth in. It's going to damage the supporting jawbone. It's going to cause loose teeth, abscesses, and ultimately tooth loss. If you have bleeding gums, pain, dental issues, or it's been more than 6 months or so since your last dental clean, then I encourage you to make an appointment to see your dentist or dental hygienist and make sure you keep your teeth and gums in the best of health. Now I'm going to share some facts about gum disease. Now I could have broken this up into smaller videos, and I probably will, but I'm just giving it you all today so you can watch it all in one place. Periodontal disease is a bacterial infection. I've talked about the symptoms of red, swollen, bleeding gums, but it is the #1 cause of tooth loss in adults. More than half of the people aged over 30 have some sort of periodontal disease. It can be painless and it may go undetected. And your oral health plays a really important role in the total health of your body. Bacteria associated with periodontal disease travel into the bloodstream and may result in other adverse health effects such as heart disease, strokes, diabetes, and even cancer. Early detection of periodontal disease is critical to maintaining overall health and well-being. Regular dental visits and gum and periodontal assessments are key components of high-quality oral care and caring for your overall health. Caring for your teeth and having a healthy mouth reduces your risk for lots of health issues like heart disease, strokes, diabetes, Alzheimer's, lung infections, kidney problems, and even cancer. Getting a regular professional clean will remove plaque, tartar buildup, and staining from your teeth. It's going to save you time and money. Prevention is better than cure, and it's more cost effective too. Regular dental care is not expensive. Neglecting your teeth is. Yes, neglect costs money to put right. Now, I firmly believe that not only do you deserve to keep your teeth for life, you deserve to have the smile of your dreams too. So watch out this video here to find out about having a beautiful $1 million smile without spending $1 million.